So I'll start as in the routine method, but this is not going to be a routine lecture. Clinical audit is a systematic and critical analysis of medical care provided to patients against established standards or criteria. As we all know, there are guidelines or sets of standards. These standards can be international standards, national standards, or our hospital standards. Or maybe there are some ward standards as well. So there are ward practices. We can compare whatever the practices or things among us in comparison to the standard method. So that is what is called as a clinical audit. So we can assess the quality of care and identify areas for improvement. Right? So you will get to know these things easily. We can identify whether we are providing the quality of care, whether there are any problems. Audit is not a research. Audit must be a part of our routine clinical management. Right? So it has to be a part of a clinical management to improve our whatever the patient care, right? But nowadays the problem is now we are publishing audits. When we are publishing audits, there are certain things that we need to think of. And the other thing is it's a part of or compulsory part of the PG training. In most of the disciplines, it's a compulsory part, right? So we'll go ahead. You'll get to know basic things about these things. So first thing is audit cycle. Audit cycle is again new concept for me as well. But so audit cycle, we generally in a hospital like this, Teaching Hospital Anuradhapura is a big unit. So as far as I remember, during my student time, many of the senior doctors told me that you all are lucky because you all are in the third largest hospital in Sri Lanka. Lots of doctors, lots of other staff, about 150,000 inward patients and nearly 300,000 outpatients. When we are handling this much of burden of this thing, so now we will be having lots of problems. Maybe problems among staff or problems with patients, right? So it's not nice to have these kind of problems among us. But if you are interested in audits, all these problems, maybe personal problems or maybe problems related to patient care or anything, if you are a person who's doing clinical audits, right, so that will be important, right? So you can use these opportunities to perform a clinical audit. So now audit cycle, simply those theory things, I'm not going to highlight the things. There should be a problem. First thing, as I mentioned, it can be any problem in the hospital. It can be, most probably it should be related to patient care, but it can be some other problem as well, right? Then you need to find out what are the standards related to the standard ways of handling this problem. Then you can collect data or you can do the audit to find out whether the standard thing is happening or not. Then you can, based on the findings, you can implement some actions, and after that you can re-audit. In order to re-audit, you need to identify the problem again. So this is kind of audit cycle. One of the famous question in the postgraduate examinations, you will be asked about define audit cycle, something like that. Okay, so that's all about it. We'll go ahead. What are the purposes? It can be something like improving patient outcomes and safety, or enhancing the quality of clinical care, or identify variations in practice, or something else. Generally, as I mentioned you from the beginning, audit is audit. So an audit is an audit. So we are auditing. There's no much difference like the audits in management sector. So we will be auditing, right? What are the benefits? Again, same like this: improved patient safety and outcomes, increase efficiency and effectiveness of healthcare practices, or enhance healthcare professionals' accountability, promoting a culture of continuous learning and improvement, encouraging evidence-based decision making. So all these are benefits. But my objective is not to describe these benefits or purpose or something like that. To give you an overview and to make you aware that you can do this, and this is a simple thing. Right, okay. This is the most important slide in my presentation, right? So you can see several verbs in the form of, is it past participle?
Excuse me, we can't see the slides.
So this is the
first slide.
Online participants, can you hear me?
Yes, sir, can hear but can't see the slides.
Okay. Okay, so no problem. Until now, I have
Sorry, slides are not moving.
Can I take it?
Desktop पे share करो. Desktop पे share करें. मैं share करें. देंगे हर एक share कर ले. Can you see moving the slides now?
Yes, sir, now can.
Okay, so I started with this slide and definition, audit cycle. It's something audit and re-audit process, and purpose and benefits. Those are theories. Anybody can read it. It's simple. But the most important slide is this one. I hope you can see. Now, in your day-to-day practice, in the wards or your clinic or whatever the setting that you are working, you can see whether something is seen. Either patients or the staff, whether something is seen. In ICU setup, these days there's an audit going on. They are trying to identify whether the staff is seeing these kind of equipments. They are seeing whether these equipments, whether this procedure is seen, whether this is heard. Whether there are some standard guidelines. Have you ever heard of it? Right? So please think about your own ward setup. And is it a known thing for you? Is it a known thing for you? Have you ever done this? Are you satisfied with this care? Or are you satisfied with this service? Or have you received this care? Something like that. Something like that. You can think of the different situations in the ward setup. And simple method is you can note it. Out of 100 nurses, how many of them are practicing this method? Out of this bunch of doctors, how many of them have heard about this? How many of them have seen this? So that is audit. What do you need? You need either nowadays you can go ahead with simple tablet or mobile phone based questionnaire or printed one. You can administer that and you can just ask them to fill yes or no. You can go further, like have you ever seen? Right? There may be people who have seen and know the procedure. So you can categorize them as one stage. And something like this, mild, moderate, severe, or something like that. So they are well aware of that. They have heard of, but they have seen it, but no proper training. They know it, and they have not heard of it. So something like that. So you can go ahead rather than going for binary type question like yes or no. You can modify the questionnaire and go ahead with that. Keep in mind throughout this lecture, right? Each and every slide that I'm discussing, always think about your own word setup or your discipline and think about whether have you ever seen, have you ever heard of this, have you done this, is it a known thing? At least the patient is recovered, died or survived. That is another type of, so you do this thing. What about the survival rate? CKD patients, you start the dialysis and other people you give conservative management. Who has the most survival? It's a research, but whether they are surviving or not is an audit. So that's all. So even I can stop the lecture now, but I will discuss few examples. Pre-hospital admissions. I would like to ask a person who's having public health background. So before come to the hospital, many people, patients are undergoing, especially gyn and obs, they are participating for the community clinics. You can do an audit whether they received this care, whether they have participated all the 9 clinics, whether they have underwent VDRL testing, whether the blood pressure checking was okay, something like that. So you can check by the time of hospital admission whether this has happened in the public health setup. So it will be a nice audit. So you can do that. The other thing is, rather than checking whether this has performed or something, so you can think about the other verbs as well. Whether they have seen this, whether they have heard of this, whether they have done this, something like that. With regards to many things. So pre-hospital admission, so any ward, right? So you can do this. You can assess the public health setup or at least the community awareness by doing an audit. So this is one of the audit that you can do at any of the ward setup. Medication safety, audit of medication prescribing errors, for example. You can check easily. You can go to the OPD and you can take about 1,000 prescription. So it will be one day you can give to different people, right? So I will explain this. I'm not going to explain each and every one, but I will explain this. So first simple audit that you can do is, you can go to the OPD pharmacy and take 100 prescriptions, right? And you can see how many of them are readable. Then you can go to the next step, audit. One step further, rather than just saying that it's readable or not, it's a binary variable. You can, whether how the proportion of prescription that can be read by the doctors. Then you can ask several pharmacies and categorize them, whether they can read or not. Then one step further, you can classify them: well readable, moderate, not clear, something like that. You can modify further. And one step further, you can give to different pharmacies in the town and do audit, whether they are readable or not. You can go one step further. You can compare the prescriptions of the hospital OPD and private sector OPD. You can go one step further. You can compare the medical versus surgical, or something like that. So, but keep in mind, there might be a problem when it comes to publishing some of these things. But keep in mind, audit, the basic purpose of audit is to improve our quality of care, right? So all the audits that you are doing may not be practically publishable, but of course you can publish some of them, but definitely you can improve the quality of care. You can improve one by one. That's all you can do, right? Okay. So that is about medication safety. Infection control. So many infection control procedures are there. Simple thing is to see whether they are doing it or not. One step further, whether they are doing properly or half of the procedure is correct, or it's just hand washing or no hand washing. Something like that you can improve. Infectious control. So think about different infectious control procedures as well. Patient safety. So many patient safety procedures are there. You can do an audit whether මේ වෙලාවේ මට හිතට එනවා මේ වාට්ටුවට disabled access තියනවද කියලා. There are about 60 wards including male and female or sites, there are more than 60 wards in the hospital. How many of them have disabled access? It's an audit. You can modify that one step further. What you can do is you can modify a little bit further and do something like whether the disabled access is proper or not. It's a simple audit. Maybe publishable, at least an abstract. Right? Okay. Compliance with clinical guidelines. This is the best thing that you can do. There are standard guidelines, but we have our own ward practices. You can compare the ward practices against the standard guidelines. One step further, you can compare these ward practices against the standard guidelines and you can see the reasons as well. And when you are finding out reasons, again, it may not be purely an audit, but it will be something like a research, but still you can identify the known reasons, whether it's a shortage of staff, why this standard procedure is not happening. Is it the problem of the staff or the problem or attitude of the staff or the consultant or the problem with the consultant or something like that. And this has happened previously but not now. One of the famous thing is two different consultants are there in the ward. This consultant practice this guideline and this consultant practice this guideline. I'm not highlighting one or other ward because I'm very third person and looking at all the wards as a neutral person, but these are the things happening, right? You can do audit. Hospital readmission rates. The reasons for readmission, whether the discharge, one audit is by the time of discharge, whether the proper instructions are given or not. You can audit it. The other audit is whether the information is received by the patient. It's another audit, right? Always you need to have a piece of paper and you can ask, right? And we will discuss the ethical aspect as well. So you can identify the opportunities for readmission reduction. Surgical outcomes, surgical site infection rates, post-operative complications, and again the previous things like the pre-medication practices, the difference between the ward practice and the guidelines. Maybe the doctors from Rajarata versus doctors from others. One step further, you can think about different aspects, right? Audit. Then once you have this audit data, you can compare with something else. Then that will become an advanced audit plus research, but you can compare. Okay. Emergency department efficacy. I can see Shashiki is there. So emergency department, few participants are here. So you can think about different aspects, including now one of the interesting request came from GMOA was they needed to do a facility survey in the peripheral hospitals, whether these facilities are available. So what they can do is, based on their experience, they can list the basic equipments needed to a hospital. Then they can do a facility whether these equipments are available in the hospitals. Second thing, whether the equipments are working or not. Third one, whether the medical officers have the practice to do it. Another thing, whether they have this practice, is it from a routine practice or is it through proper training? So you can improve the quality. That is the emergency department efficacy. So you can reduce the waiting time. I hope in Anuradhapura ETU there's no problem as such, but you can do it because you can improve. Chronic disease management. There are so many chronic diseases. Whether the HbA1c is performed in the given intervals. If it is not happening, why is it not happening? So you can do asthma prevention, inhaler practices, many things. When it comes to ward practices, even the cannula insertion, NG tube insertion, whatever the thing, is it happening properly or not? Maternal and child health, prenatal care, the one I mentioned, neonatal resuscitation and newborn care. So how many audits can be done in ICUs and NICUs and these places? Pain management, compliance with pain assessment, with referrals to the physiotherapy units, whether all the patients are referring adequately, referring criteria, or whether unnecessary referrals are there. Once they referred, how many patients are attending to the physiotherapy or counseling or whatever the other session. All are audits. I think I have mentioned about 50 to 100 different audit opportunities that you can do. What you have to do is go and practice. Communication and handover, right? I hope that is not in Anuradhapur, but especially in the peripheral hospital, and we cannot make it up with a bunny in the whole. Especially some of the peripheral units. Antima bus එක යන්නේ 5ට, but duty shift is at 6:30. එතකොට සමහර වෙලාවට බස් ස්ටෑන්ඩ් එකේදී තමයි duty hand over කරන්නේ. third patient එකේ patient මෙහෙමයි මෙහෙම කියලා duty shift is happening in the bus stand. Right? So you can do audit. Not to penalize somebody, but to improve care. The best solution may be to change the bus or discuss with Langam and do something like that. So rather than penalizing, you can improve the quality. And with regards to communication skills, counseling skills, you can do several things, right? I'm not telling that our communication skills are bad. All of our communication skills are good, but all of us can improve because different people have different methods of communication. සමහර අයට ලේසියෙන් ප්‍රශ්න හැන්ඩල් කරන්න පුළුවන්, සමහර අය කමියුනිකේට් කළ වෝඩ් එකේ ප්‍රශ්න අඩු කරනවා, සමහර අය කමියුනිකේට් කළ වෝඩ් එකේ ප්‍රශ්න වැඩි කර ගන්නවා. එතකොට වෝඩ් එකකට ප්‍රශ්නයක් නැති වෙන්න communication already ගියාම සමහරලාට ඇඳන් 40යි තියෙන්නේ, there will be 120 patients and 2 doctors in the ward. It's difficult to manage. එතන හොඳ communication එකක් එක්ක IV ඕන නැති patients ලා කොහොමද ගෙදර යවන්නේ? We can improve the quality of patient management. Patient management has 2 aspects. One is the medical management, the other one is ward management, administrative management. How we can discharge the patient, 40 beds, 120 patients, we cannot limit the patients. We can limit the patients by improving the quality of care in the public health. That is one aspect. The other thing is we can minimize the unnecessary admissions and we can discharge the patients. And we can have new plan to follow up in the wards, right? So we can do lots of audits with regards to that as well. Mental health, you can think of many ways that you can do audits with regards to mental health, right? How many doctors are having mental health issues by the time of retirement? Okay, what is it? I don't know. By the time of duty off or something? They may not be really some mental health disorders, but something like that. And when now doctors have some flexible rotations, but the other staff members, they have to be there. So another audit, how the family members' life, that may be audit, whether they are satisfied or not with regards to this job. If you are the wife or husband, whether the husband is satisfied with my job or not, it's another interesting audit. You can publish definitely. So again, another few audits, right? Not sorry for this. This is radiology and imaging. I don't know whether anybody is there in radiology, but I have lots of experience with regards to radiology these days. One of the main thing is we are managing the patients. How the radiology people can refuse this. In other side, the problem is in the radiology unit, is it really necessary? We are overburdened. Both are correct. You can do simple audit and improve the quality. Then there will be no problems. And accuracy and appropriateness of imaging request. To be honest, my handwriting is bad. I thank all the nurses and other staff who read my handwriting. The most problem is my handwriting is not that bad if I want to write it properly. But all the nurses never complained. But there were time to time when I was a house officer, there were some complaints from the ECG department. They cannot read it. But as the house officer, I could remember all the Dr. කොතනද ලෙඩයින්න මට කියන්න පුළුවන් වුණා. අපිට එක දවසක් අමුතුම නමක් තිබ්බ patient කෙනෙක් මට නම කියා ගන්නත් බැරි වුණා. මේවා කියා ගන්නත් බැරි වුණා. Then he asked me, then doctorටම තේරෙනව නේද අපි විඳින දුක. So you can do some audit with regards to that. Okay. Well, he was that person. He's one of my good friend, but he was searching some opportunities. To put the blame in me, and he got that chance, but I accepted that because it's my handwriting. Okay. Lots of things like ultrasound can be done by the medical officers, but when it comes to CT reporting has to be done by the consultant, whether they are overburdened. Stroke care. Now, so different things you can do audit with regards to the patient, starting from the patient until the last management. Lots of things that you can do, whether there's a delay or not, whether there's a delay in seeking of care, whether there's a delay in choosing the proper place, whether there's a delay in thrombolysis, whether there's a delay in whether there's a problem in the outcome. That's all. Okay, what are the tools? What are the tools that you can use? As I simply mentioned, it may be a Google form or some other electronic form that you can make it, or event calendars. Now in dengue, for example, you have to perform the hematocrit in this particular interval, whether this is happening in that interval. Event calendar, whether by the time of discharge, we ask the patient to come with the full blood count in 3 days, serum creatinine in 2 days, something like that. Whether this event is proper, whether the patient is followed up in the proper interval. You can do questionnaires as I discussed, and focus group discussions. Focus group discussions and patient interviews. We can assess the patient satisfaction. You can assess using this kind of scales or questionnaires as well, but the best thing to assess the patient satisfaction is doing a simple interview with them. You can discuss. මහත්තයා හොඳයි කියපේව තේරුණාද? තේරුණා. මොනවද තේරුනේ? සපත්තු ගලවලා එන්නකෝ something like that. කියන්නේ තේරුණා වුණාට patient satisfied, but about කතා කරපු විදිහ, but not about the instruction. මේ කියන ඔක්කොම ප්‍රොබ්ලම්ස් දන්නේ ක්ලිනිකල් කෙයාර් එකේ වැඩ කරන අය. එතකොට ඕගොල්ලන්ට තේරෙනවා එක දවසක් ගත්තොත් there may be 1000 audit topics. You can do audits. Patient interviews and scales. You can do scales, pain scale, like that. Different scales. Okay. Data analysis. Before planning, you need to think about this. Not the statistical basis of data analysis, but how are you going to measure the final outcome? Right? Okay. With the delay, think that we are assessing the delay. One method is proportions. Out of this, how many of them are delayed? Out of this, the proportion of professionals who are communicating properly, adequately. You have to define what do you mean by adequate. Right? You can measure the mode, the most commonest organism causing UTI. So community acquired one or hospital acquired one. Right? Audit. Compare rates. This rate, okay. death rate in this ward. So I'm just joking, but death rate in this ward versus the death rate in this ward. If there's a problem, if both are similar, then there's a problem, isn't it? After excluding the confounding factors, right? So you can identify the key themes as in the example patient satisfaction. What are the key themes? If they are satisfied, what are the key areas that they are satisfied about the quality of dresses or the way that the hospital staff is dressing, whether the punctuality of the staff, whether the communication skills, whether it's about the management or something like that. If they are dissatisfied, what are the key themes of dissatisfaction? You can do several audits. Survival analysis, as I mentioned, who has the best survival? Compare means which has the highest average. You can compare. So you can do. So audit is something that you see whether this is happening or not, whether this has seen or not, whether this has heard or not, whether this is so like that. Ethical consideration. So although I'm the secretary of the ERC committee faculty, but ethical consideration is one of the most important thing in ethical considerations, one of the most important thing with regards to patient safety. But nowadays, with all these practices, even though somebody is interested in doing research, they have so many problems when it comes to ethical clearance. It takes time. But what about the other aspect of ethical consideration when it comes to audit? Generally, if you are doing an audit just to improve the quality of care and not for publication, you can think about the different ethical aspect, and you can think about what are the other. You are going for informed written consent or informed consent or some other consent. You can think about these aspects, ethical aspects. But if you need to publish it, it's better to get the ethical clearance from the ethics committee of faculty or whatever the ethics committee is. And the other thing is audit approval. So in many hospitals, we discussed with Pratibha as well, there are many hospitals, they have these audit approval committees. Anuradhapur, I think they need this committee, and with this committee approval, there can be a proper audit guidelines and all, approval suggestions. You have to write a proposal as well, right? And this committee can give the approval for the audit to conduct. But the problem, if you are doing that for your postgraduates or something, निकम्म करला quality के improve करने का होता है, but you will be improving the quality in your ward only. If you have done this and it's there in the web or in the journal, right? If it is there in the journal, the next thing is, if it is there in the journal, anybody can read it. No need to do re-audit, just you can implement. So it's important to publication. So it's important to get the ethical clearance in that aspect. Because nowadays, this migration opportunities and everything, it's important. These are a few things. Prospective audit of pathway of inpatient pain management of chronic abdominal pain, a novel cost-effective strategy. I think it's about 2 years or 3 years follow-up period, and what happened, it's about 43 patients with regards to acute abdominal pain. They audited how many of them had somatiform or somatic complaints, how many unnecessary ultrasound scans, how many, what are the different problems, how many of them had the typical clinical history. So like that. The use of patient experience survey data by out of hours primary care services, a qualitative interview. I mentioned, so they did some focus group discussions and in-depth interviews. So qualitative methods, and they measured the patient satisfaction as mentioned. An audit of the outpatient followed up of hip and knee replacements, audit in orthopedic unit. Prospective audit of a pathway for inpatient pain management and chronic abdominal pain, a novel and cost-effective strategy. Yeah. So when it comes to here, cost minimization is another good benefit other than improving the patient management quality. You can minimize the cost. Right. So I discuss lots of things about, I think, 150 or more audit topics, different topics. What you have to do is go and start this thing. For the moment, there's no proper authority for approval, so you can easily conduct this. But when it comes to publication, you might have to you might need this ethical clearance. So ethical clearance applying for taking retrospectively is not ethical. So it's important to have the ethical clearance before doing the research. But if you are doing that with the secondary data, if there's no proper ethical issues, so you can go in both ways. So thank you very much. Cost accounting is the most thing. So with regards to audit, so that's it. If I summarize, think about ethical aspects. You can do audits, stroke care, radiology, mental health, communication handover, pain, maternal and child health, chronic disease management, emergency department, surgical outcomes, hospital readmission rate, compliance, patient safety, infection control, medication safety, pre-hospital admissions like public health and community awareness. And if I forget all other theories, this is the most important thing. When you are practicing in ward, either it is related to patient history or health seeking or public health or history, examination, management, diagnosis, or any other procedure, think about whether our staff has seen it, whether they have heard of it, whether they know it, whether they have done it, whether they received it, or whether they are satisfied with it, or many other verbs that you can add, all audits. That's the introductory lecture for clinical audits. I intentionally avoided this audit proposal writing. So we will be doing this audit proposal writing as a part of ACS Research Academy. So we can introduce simple part of audit writing. But if you are really interested, you can find out proposal format. Now you have artificial intelligence in web. You can get the support of that. But special advice, if you are using artificial intelligence for your academic works, do not ask ChatGPT to produce that for you. It's difficult to get what you need. But the best thing is, you can give everything and ask him to paraphrase or rewrite it. Now it's not plagiarism. There's a I cannot remember the authority that they issued. I think now there are proper guidelines for academic things or research things, how to use artificial intelligence. You can refer that guidelines and you can use it in the proper way. If you are writing a paragraph, simple way of doing it is, you need to write about HIV, right? HIV, give me an introductory chapter of 300 words with reference with regards to global epidemiology of HIV. So rather than that, best way is read and write and have a story in your head. You need to have a story in your head when you are doing this research thing. Now you should be sure about, now I will write the global epidemiology first, then you will be writing the local epidemiology, then you are writing about the ward procedures, then based on this, I will highlight the problems in the ward, then I will write about the different research related to this particular problem, then I will summarize. Now you have the story in your brain and you can type whatever the things in whatever the language, English language, in whatever the way you can write. Then you can ask the ChatGPT to correct it. So that is a good way of doing that. Okay, so final message is, audit is the easiest thing for a practicing doctor when it comes to research. Because you are the person who's treating, who's managing the patient, and who know the problems. With regards to the patient journey, then you can ask whether it's true or false. As I mentioned, whether it's moderate, mild, or severe, something like that. So that's all about it. Thank you very much. If you have any questions, I can answer. I can see about several participants from online as well. මගේ එකද?
audience.
ඔය settings වල තියෙන්නේ unmute and commute වෙන්නද? නෑනේ.
If everyone's muted, you can unmute them.
නැත්නම් මොකද ඒගොල්ලන්ට unmute කරලා කතා කරන්න පුළුවන් නේ? So you can ask if you have any questions. I can see iPad, C, Bandara, Rajit Ekanayaka.
So if we are to use a questionnaire, do we need to use a validated questionnaire, or can we make our own questionnaire?
Okay, so for the physical participants, I will highlight this question now. Whether the questionnaire is validate, whether you need a validated questionnaire or you can use your own questionnaire. It's very important question and one of the practical problems that most of the researchers and doctors are having, right? The proper answer is it depends, but I will explain why it depends. Now assume that you are assessing whether the mental health status of the patients, right? So mental health disorders, it's not, most of the time they are not biochemical investigations or something like that. That depends on the clinical history and examination criteria. And based on this criteria, you do it. If in that case, it's important to have a validated question, right? And what you have in practical setup, what you have to do is assess that, think that, now you are doing audit about hand hygiene, a simple thing, whether they are washing hands or not. You can do a search whether there are validated questionnaires, whether there are any validated questionnaires for this, and refer it. If it is proper, then the next thing is translation, validation, cultural adaptation, so many things. So if it is really necessary, yes, go for validated questionnaire. But sometimes in most of the cases, or more than half of the examples that I mentioned, I hope that the camera is this one, right? Okay. Most of the half, or more than half of the examples that I mentioned, you don't need validated questionnaire, but it's important to at least the first stage of validation, that is phase validation. You prepare the questionnaire, at least validate and pre-test and use it. That is more than adequate. If your aim is to improve the quality, even you can go for publication. The next thing is make sure that there's no validated questionnaire for the particular thing. I think I answered that question.
Thank you, sir.
Sample size, right? It's good. Sample size is the favorite area of my teaching, and you need sample size. It depends on your objective, right? Now, generally, I'll explain in detail. The first thing, you need to determine the prevalence of diabetes in a particular village. And you need to determine the prevalence of HIV in a village, in the same village, which needs a higher sample size. HIV, why? It's rare, right? So STD experts are there. I hope it's same. HIV is rare. Diabetes, it's common. 100ක් බලනකොට 30ක් විතර ඉන්න පුළුවන්. ඒ හින්දා පොඩි sample එකකින් we can assess. But if you need to find out the prevalence of HIV, you need a higher sample size. right? So that is the sample size. When it comes to audit, in this specific question, for some of the objectives, yes, you may need, but the major limitation is you may be doing the audit to improve the quality of care in your ward. There may be 4 house officers, 4 senior house officers, 3 registrars, maybe 1 senior registrar, and 2 consultants, so 1 consultant, right? The idea is to improve the quality of communication skills or something like that. So then definitely your target population is that 7 or 8 doctors. In that case, don't think about the sample size, but more importantly, when it comes to publication, sometimes a simple audit conducted in one ward may not be an interest of the editors of an international journal. But again, it may be important for the local people. But if you are doing it in Anuradhapura, we are always happy to publish that. If you are writing properly, we are always happy to publish that in Anuradhapura Medical Journal, which is among the top 1 journal or top 1 or 2 journals in Sri Lanka right now. Hopefully, we will be able to index that in PubMed in next 3 to 4 years. Then after CMJ, so this will be the second journal. So this time, page, I don't know the ACS financial situation. We have about 60 or 64 pages, nearly 70 pages in AMJ. But so many financial aspect as well. So we can discuss about that as well, whether we are printing or not. For the researchers, it's the soft copy is enough. That is very important. Another lecture, publication, but there are when it comes to publication. So publications, it says low battery. When it comes to publication, there are journals. There are 3 types of journals. Like there are several types. There are index journals and unindexed journals. Index journals means when it comes to index, there are so